So we said we'd talk about the opioid crisis, and based on your extensive travel repeatedly around the state, seeing things firsthand, and really also because of your extraordinary experience in the healthcare arena, what are we doing and what do we need to do?
Well, one thing that we decided to do last year was when we failed to get the legislature to agree to help us work on opioids is through the Medicaid program, we were actually able to deal with some of the supply issues. And supply is not the only issue, but physicians routinely write 30-day prescriptions for opioids. You can't change it. You as a customer or patient can't tell the pharmacist, give me 2. So we have a lot of people that end up with 30-day supplies when they had a root canal done or they had something minor. So what we did in the Medicaid program was we restricted the ability of physicians to prescribe more than 7 days. There's a waiver that allows them to go if there's a circumstance, but that was one way of cutting back on the supply. Now the legislature actually is now talking about doing the same thing for the entire state. We also have something called a prescription drug monitoring program where some of the people that are opioid abusers are going to multiple doctors. And we have a program, but it's not mandatory that you use it. So let's pretend that I go to Dr. Harber and Dr. Smith, and you can actually look up if I have an opioid prescription. And you might have a word with me and say, I can't give you more. But that's not mandatory. So we are also trying to make that mandatory, that doctors use that, and we think that's not an unreasonable thing. They are a trusted source. They should be able to intervene. But then there's treatment, and that's an important part as well. We can't just say if we cut off the supply that everything's going to be great. So the state does have a role in providing opioid treatment and, quite frankly, just addressing that it is an issue and destigmatizing it so that people who do have a problem will get care.
Well, and one of the issues, of course, if you cut off that supply, the legal or legitimate supply, is that for some people it drives them to the street where they can purchase heroin and suddenly they're out of the system and in a worse position because they don't really know what they're consuming or ingesting or injecting. Right. How do you deal with that challenge, especially for people who really do have chronic pain?
Well, I think appropriate use of opioids is fine. But ironically, a study came out today that where 66% of doctors, when they were queried about their prescribing habits, were shocked to find out they were over-prescribing. So I think that's the first thing, is to just create more awareness around the dangers of over-prescribing. There's no question we don't want people getting heroin as a cheaper but more riskier alternative. And giving treatment to people is part of the challenge that we have to face in this state. And we don't have a lot of treatment facilities for either opioid addiction or for heroin addiction.